negotiations. Where I think everybody here is pretty informed, but where it stands is the House passed a bill the week before Christmas, very narrowly, about 4 votes. I voted against it. The Senate passed a bill literally on Christmas Eve that was quite a bit different. The process when both houses have acted on a topic, as we all remember from our high school government, is each house appoints a conference committee. Conference committee irons out the differences between the 2 bills, and then each house has to vote in favor of the combined bill again before it goes to the president for his approval or disapproval, his veto. We are in the process where each house has now appointed conferees, and the discussion has started. I believe that I don't know because I haven't been back there. I go back to this. I go back to the salt mine on Sunday, so but I haven't been talking to my office back there with great regularity while I'm here. I think that process of reconciling 2 bills will likely take into next week sometime, and the 2 houses will be asked to vote very earliest into next week, or more likely sometime the next week. That's the timeline. The question that you ask is, would that, essentially, is that conference, one of the questions you asked, is that conference process public? And that's subject to a lot of discussion right now. The answer right now is no, it's not.
Well, on C-SPAN, they did say that it was going to be 1 hour on C-SPAN. We know that today was announced that they were going to put 1 hour of it on C-SPAN. But we know that Nancy Pelosi can take an hour to introduce everybody. So we're really not going to get any information.
Usually our conversations with me are a lot shorter. It's a legitimate question as to whether all of those discussions should be essentially subject to open meeting law, or whether some of them, whether you get further with some of them being people will be more candid and make more progress. I'm not going to take a side on that issue. The current rules are that it doesn't have to be public. I am confident that just as we've had that discussion with the Idaho legislature, that if enough people want all of those discussions to be public, that Congress would pass that kind of law. But at the moment, it's not required.
What about the one-on-one? When they're calling 1 or 2 senators in, and then they leave the room and they've got to change the vote. That's what I'm talking about.
The negotiation between leadership and a congressman or a senator is also not subject to public meeting laws at the moment. I've been in those meetings with the speaker. I've been in those meetings with the cloakroom. You have those discussions as you're going between colleagues as you're going home and back and forth. You'd have to define, again, the circumstances by which discussions of legislation could only take place with essentially a camera behind your back. I don't think it's practical to have a camera behind the back of every congressman 24 hours a day. And it's almost impossible if I run into you on the street and healthcare is the issue, not to have a discussion with my colleague Joe.
That's understandable, but when it comes to things like what Ben Nelson did, that's just out and out right.
The question was, if it comes to things like Ben Nelson did, which was require, as a condition for his vote, that citizens of Nebraska not have to contribute the state share of Medicare payments. That's a tougher question. And when I talked to the majority leader about the schedule last week, I told him, I raised that issue specifically. I said these special deals that were required to get the 60th vote in the Senate trouble me greatly, and that I'm in the process, myself and my staff, going through that 2,000-page bill, which I think will be closer to what the final bill will be than what the House bill, trying to understand it and trying to find out what other special deals are in it. And to the extent there are special deals, it makes it harder and harder to me to vote for the bill. I haven't decided whether to vote for or against. That's why I'm asking for the show of hands at the end of this. But I don't believe a citizen of Nebraska should somehow be treated different than a citizen of Idaho when it comes to coughing up the non-federal share of Medicare benefits. It just doesn't pass the smell test with me. And those discussions, while I think you can't entirely make them public, the results of them are definitely public, and it will have a substantial impact on how I eventually decide whether the pros and the bills or the cons of the bills lead me to vote one way or the other. I would recommend that I should vote for it. See a show of hands. On health care, yes. You don't have to vote, but if you have an opinion, I'd like to know what it is. It's healthcare, the healthcare reform bill.
What's
It's just the title, healthcare reform.
You've had it, you have 2,000 pages. We have nothing.
Okay, based on what you currently know, how many people have voted against, vote no, recommend vote no? I don't know that we need to count every hand, Dean. Just
It's about even.
No, it's not. It looks to me, yeah, I would estimate it's about 5-1 against the bill, would be my guess. That's just my country count. But okay, listen, you've been a great audience. I appreciate the questions. Very much appreciate your time. Thanks for being here this evening. Good luck, guys.